Bec Mills here from Beyond the Bandaid. I'm just talking to Dr Nicola McFadzean. She's over from the United States and she was here speaking for a conference. I'm lucky enough to be here today at her mother's house in St Ives. We're just going to have a chat today about treatment protocols specific to Borrelia infections, Babesia infections and other tick-borne infections.
Hi, I'm Dr Nicola McFadzean. I'm a naturopathic physician and I'm based in San Diego, California. I've been working as a naturopath there for about 10 years now and treating Lyme disease for about 7 or 8 years. And I first got into treating Lyme through working with children with autism. I was working in a practice that predominantly worked with autistic kids and started treating some of the parents, some of these mothers who were exhibiting fibromyalgia and chronic fatigue syndrome at age 30 something. And so in my investigation of what could be causing their health issues, I started testing them for Lyme and they started showing up positive one after another. And so I knew that I had to learn more about Lyme disease to be able to treat the moms of these kids. And of course then we started investigating the kids too to see if they had contracted Lyme also in utero from their moms and whether that might be contributing to their autism. So that's where it all began. Started in California, and then a couple of years later I started consulting with some Australian patients, and that's really sort of grown a lot. It's taken off a lot from there, and I've consulted with probably 350, 400 patients in Australia over the last 5 years or so in relation to Lyme disease. And so that's my primary focus. Probably 95% of my practice is now working with Lyme disease.
And do you have your own practice or is it somebody else that you work for?
Yep, no, I have my own practice. And we're trying to create a multidisciplinary center. So we have some psychotherapists, we have a chiropractor joining us, we have a nutritionist, a massage therapist and Bowen therapist. So we have a nice team of people.
Nick, how important is it to have an integrated approach to treating something like chronic Lyme?
I think it's crucial. I mean, I've seen patients who were treated just strictly with antibiotics, and there were definite limitations to that way of doing things. Antibiotics are very, very important, and I would say probably 90% of Lyme patients are going to need antibiotic therapy at some point. I'm a big fan of antibiotics for Lyme disease. However, I think that the integrative approach and using natural medicines can just make it so much safer for the body. It can make the results so much better and quicker. And the natural medicine can allow the antibiotic therapy to work better. For example, if we can use natural medicines and herbs to support liver function, and therefore we see liver enzymes staying normal throughout antibiotic therapy, that allows the therapy to continue. Whereas if liver enzymes go up, we need to cut back on medications or even stop medications for a period of time until that rights itself. Same goes with yeast overgrowth and candida overgrowth. If we can prevent it with high-dose probiotics and other things, then that's going to be so much better than ending up with a yeast problem and having to stop antibiotic therapy to deal with the yeast problem and then risk symptoms returning in that break.
Okay, before we go further into treatment protocols, I was just wondering if you could tell us a little bit about anything that you've written and published?
Sure, yeah. So my first book was called The Lyme Diet, Nutritional Strategies to Healing from Lyme Disease. And that really came out of a desire that my patients had to help themselves using nutrition. People would often say to me, well, how can I adjust my diet? What things would help me in my treatment, in my treatment path? So I sat down to write what I thought was going to be a 2-page handout on nutrition, and it turned into a book. But it's been a good resource because, Lyme is such a disabling illness, and there's such a sort of loss of power that comes with it. People feel very vulnerable, very powerless over this illness that seems to just take over their body. And so giving people tools that they can then grab onto and utilize and put to work in their day-to-day life is really, really helpful. And I find my patients who do make nutritional changes, even if they take some adjustment, even if they're not easy in the beginning, they fare so much better. So I've been really happy with the response to that book. And I think that a lot of people realize that adjusting their diet and using nutritional strategies can be very, very helpful. So that was number one. I also had a chapter in Connie Strasham's book, which was Insights into Lyme Disease Treatment. 13 practitioners share their Lyme treatment strategies. And that was a real honor because she really she went around the world and found pioneering doctors and really highly experienced doctors and got all of their their philosophies, their way of treating, modalities, treatment protocols, and condensed them into one book. So that was great. And then last year I published 2 books. One was Lyme disease in Australia, and that one talked a little bit about the political situation here in Australia. It also talked about the political situation in the States, because that's really kind of a lot of what's filtering down here. But then had lots of practical information about possibilities for testing signs and symptoms of Lyme and related infections, different treatment protocols, antibiotic protocols, natural medicine protocols, and then tools for coping, emotional strategies and things like that. And in the States, I released that as the Beginner's Guide to Lyme Disease, which is really covers a lot of practical information for people who may be new to the world of Lyme disease or maybe not. But there's lots of different ideas about treatment protocols and things like that.
Great. Okay, so I'll just have a quick look at my questions. So in your experience, Nicola, what has been the best way to combat something like chronic Lyme? And if we're talking about chronic Lyme, you can touch on other co-infections if you want to just talk about what approach usually works the best, and if you've tried other approaches and they didn't work.
Yeah, so...
sorry, I might just stop that there.
Okay.
And we get you from again. Off we go.
Oh, question for you though. Do I look at the camera or look at you?
Either, whatever you're comfortable.
Okay.
If you want to look offside, that's fine. Most people who are really confident and comfortable look straight down the barrel, but if you want to look off center and chat to me, that's whatever.
Okay, right. I think this very much goes back to the integrative medical approach. So my training was in naturopathic medicine, so I was much more about the natural therapies. And when I started working with Lyme, doing any antibiotic prescribing, truthfully, was very overwhelming for me because it is quite a complex area and there was quite a learning curve. So I started out very hopeful that I could treat Lyme just using natural medicine. And unfortunately, I don't fully believe that that is the case. I do have some patients who are just doing herbal treatments and doing great. They're recovering, they're feeling really good, they're getting their life back. But it is my opinion, after these years of experience, that the best approach is to do long-term antibiotic therapy coupled with naturopathic support. So that's really the sort of philosophy that I treat from. I do like adjunct therapies. I do love hyperbaric oxygen. Any kind of oxygen therapy I think has a lot to offer, whether that be hyperbaric oxygen or ozone treatments, things like that. I do have some patients who use Rife technology and have had great success with that. I haven't been really hands-on with that, just mostly for FDA regulations in the States, but I do hear patients talking about their experience with it. But for me, I sort of ground a lot of my treatment in naturopathic support, in particular immune support and detoxification, and I can talk more about those in more detail later on, coupled with usually multiple antibiotics, typically long-term. And with Borrelia and Babesia and Bartonella, there's some overlap in the protocols, but there's a lot of sort of distinctions that have to be made too. So Babesia, for example, is protozoa. It's more like a red blood cell parasite, whereas the Borrelia is a bacteria and Bartonella is a bacteria. So the medications that work for Borrelia are not necessarily going to work for Babesia. They have sort of quite distinct treatment paths. So I do couple herbal antimicrobials with the medications. I think, the more we can do naturally, the better. And I do think that sometimes the herbs can potentiate the antibiotics and they work nicely together. But a lot of emphasis I place on detoxification to help prevent Herxheimer reactions and things like that. Again, it just allows us to treat a little bit more aggressively, get the job done quicker and more efficiently without any collateral damage on the body.
Great, okay. I'm really interested in talking to you about why Babesia, for example, needs to be treated before Borrelia, or why Bartonella may need to be treated before Lyme. I've just heard so many different reasons, and I'm liking the idea of naturopathic medicine as well, because I think that that's a big part of treatment.
Yeah, and I think that the opinions seem to be changing a bit. I remember at ILADS conferences 4 or 5 years ago, hearing some of the top names, Barisgano and Horowitz and doctors such as those, were saying absolutely Babesia needs to be treated first, or it's going to be very difficult to recover from Lyme disease. Then in the last 2 years, say, the sort of premise has changed a little bit to treat whichever infection seems to be dominant. Whatever seems to be causing the most symptoms, go after that. Now, I still pay a lot of attention to Babesia, and if I do suspect Babesia is present, I will want to treat that first up. Again, just from a clinical standpoint, I've seen it where if Lyme is treated but Babesia is missed, the patient just won't get better. And I just think it's probably because the medications for Lyme don't hit Babesia along the way, whereas they might have some impact on Bartonella along the way. One of the big problems, I believe, is that Babesia often tests negative, and so it's easy to look at the lab report and say, oh no, Babesia is not there, we don't need to worry about it. Or some doctors who are newer to Lyme, and this is possibly true of doctors in Australia where the Babesia testing isn't right here, they'd have to seek it out from overseas. It may just be that it's not even looked for. So I'm at the point, just having seen so many patients, where I can really hear Babesia. I know what those hallmark symptoms are, and so I can recognize it, and I'll treat it even with a negative lab result, because I do believe that with the antibody tests and the FISH tests, there are many negative results even in a positive patient, a patient who is exhibiting those key symptoms.
Okay, well, if we're on the Babesia pathway right now, can we chat about the clinical hallmark symptoms?
Yeah, so when I think about Babesia, it loves the head and neck. So I think blurry vision, ringing in the ears, often a sore, crackly neck, shortness of breath, air hunger, nausea, dizziness and head pressure more than headache, temperature regulation problems. People are either really cold when everyone else is hot or vice versa, just can't regulate their temperature well, night sweats, and also hormone imbalance. Babesia loves to mess with the hormones.
Right. Did you want to continue maybe going through Bartonella symptoms and then Borrelia symptoms?
Sure. Well, Bartonella and Borrelia have a little bit more overlap. So if you're thinking about, if you're hearing joint pain, headaches, major fatigue, things like that, that could be either. Bartonella, I do look for pain in the soles of the feet. That's a hallmark Bartonella symptom. Pain around the rib cage. And then often people will report either things on the skin that look like scratches or that look like stretch marks, but they're either a funny color or they're just not in a location that one would expect them to be. So you get this sort of stripy appearance on the skin. The other thing I see in Bartonella is severe psych symptoms. So that might look like severe anxiety. Often it crosses over to panic attacks and or quite OCD type behavior. So if I see the really severe psych symptoms, I'm thinking about Bartonella as well. And then with the actual Borrelia, one of the things I look for with that is the migrating joint pain. So the pain moves from joint to joint, on any given day, or it may happen over a period of a few weeks. Borrelia tends to cycle on about a 4-weekly cycle. So I look for flares of symptoms every 4 weeks. And then, headache, joint pain, fatigue, those kinds of things.
Nick, have you noticed that there's a difference between species in certain countries? Like, say, for example, American stranded Borrelia might be more joint pain, arthritic changes, whereas here in Australia it might be more neurological. Any hallmark distinctions?
I hear that. I've heard that from other patients and things like that. In my experience, there's not that much difference. I have a lot of patients in America who have terrible neurological issues, and I have a lot of patients in Australia who have horrendous joint pain. So yes, I do believe that the strains here in Australia are more the European strains. However, I haven't seen there to be a tremendous difference between the symptom pictures here and the symptom pictures in the States.
Great, cool. Okay, I'll just check the question list. Are there any other infections that you see common in treating any kind of chronic illness?
Yeah, I mean, I do see cases where of mycoplasma, chlamydia, pneumonia, things like that. Probably more so in patients here in Australia than patients in the States. In some ways, I tend to think that they'll probably get treated along with the Borrelia, because typically we'll use doxycycline, minocycline, those kinds of medications for their Borrelia treatment anyway. And sometimes the antimicrobial herbs will also be broad enough spectrum to cross over to that. So I see a lot of that. I see a lot of this candida overgrowth, irrespective of people doing antibiotics. It seems like, that candida, systemic candida, is an issue in Lyme patients anyway, not just as a secondary result of antibiotics. So sometimes I'll try and do a really good burst of antifungal treatment right in the beginning, especially if we're doing lab work that's going to take a few weeks to come back. Then sometimes I do antifungal treatment just to try and clear up as much of that as possible before we even launch into Lyme treatment. I also see many people test positive for chronic viruses like cytomegalovirus, Epstein-Barr virus, HHV6. And when I first started doing Lyme treatment, I was trying to factor in antiviral treatment too, thinking that this was an important piece. And I was very disappointed in the results. Doing antiviral treatment didn't seem to get too many people too far along their path of recovery. So now, and this is just my opinion, but now I believe that most chronic Lyme patients carry around those viruses, probably most of us in the general population do. I'm not convinced that they're causing a great deal of symptomatic trouble compared to the bacterial infections.
I hear that a lot, a fair bit. Most doctors say, yeah, they're there, but do they play a big role? And mostly, well, I don't think so. Can you just please clarify what and how these tick-borne infections are transmitted? Because I hear sometimes pass through utero, sometimes it's ticks, sometimes it's flea, sometimes it's tick, flea and mosquito.
Mm-hmm.
I mean, are all these bugs transmitted the same way?
I believe there are a lot more vectors of transmission than we really, than is actually documented. I mean, obviously with Lyme disease, people think of it as a tick-borne illness. But I've had patients, I had one patient who was bitten by a sea lice in the water in Mexico and got Lyme disease. So I think that fleas, mosquitoes, I think, it's definitely probable that they're passing these infections along. I also, I hear a lot of cases, especially here in Australia, where children have got Lyme from their mom. So definitely congenital transmission and sexually transmittable too. I've heard lots of stories where partners, spouses have become infected. And I see it more here in my Australian patients than I do in the US. I don't know why, but I have whole family units, so I'm treating the entire family. And what I see is just a recurring theme is the mother might be ill, the kids might be showing some signs and symptoms, although it's quite difficult to see in a, sometimes as little as two-year-old if they're having some emotional issues or behavioral issues. Is that just 2-year-old being fussy, or is it that there's a problem? If there's joint pain, is it growing pains, or is it a problem? But I have seen where whole families test positive for Lyme, and the mom might be sick, and the dad may be totally asymptomatic, but he's tested positive, and the kids are all positive. So I actually recommend treating the dad as well. Firstly, because even though he's not sick now, he might become sick later if it's untreated. But also, he could reinfect his wife while she's getting treated. So I think it is important, even when someone is not symptomatic, if they have a positive test result, either a PCR or an IgM Western blot, to do some treatment.
Great. And if you could just confirm what exactly is a vector, because I thought a vector was maybe more of like a blood-sucking creature, but does it also need to be able to suck but transmit?
Yeah, I mean, my understanding, and don't quote me on the finer points of the linguistics, but my understanding is, the vector is just the critter that transmits the infection and carries the infection. So I think there's just, unfortunately, the research isn't being done to know exactly how a lot of these infections are being transmitted, and it needs to be done.
Okay.
So.
Good. I did want to ask a quick question about in your particular practice, and you mentioned the autistic, you kind of started seeing a lot of autism. Are there other neurobehavioural diseases that you see in practice alongside autism with the Lyme, or is it mainly just autistic?
Well, it's sort of hard. Some kids have that dual diagnosis. I see a lot fewer children with autism now, and that's for no reason than that Lyme has really sort of taken over my practice. And I really focused on the Lyme disease part because there were plenty of doctors treating autism and doing the natural treatments for autism, which I think, it's amazing seeing these kids sort of losing their autism diagnosis through using natural medicine. So I felt like the need was more for the Lyme. That's really where there was a big gap, and especially with working here with the Australians and Lyme disease. So I've sort of moved away from the autism area now, and so I didn't really get to test enough kids to see how many of them were positive for Lyme. And there's a lady in the US named Tammy Duncan. She's founded the Lyme-Induced Autism Foundation, and so she did look at some of that, and it was clear that there was a subset of autistic children who were positive for Lyme, but not all of them. It wasn't like that was the direct correlation. But then in older patients, and the majority of my patients are adults, I have seen, other neurological illnesses, not necessarily neuropsych, but, Parkinson's disease, MS, things like that, where the symptoms resolve with Lyme treatment. So that's really great to see. I would assume that there's a certain component of dementia, Alzheimer's, things like that, that may be, degenerative chronic illness like Lyme, just because we know the impact it can have on the brain.
I'm going to stop the camera now.